So, Mr. Ratan, tell me a little bit about what first brought you to see us, kind of the challenges you were facing at the time, and what your goals and desires were in your treatment.
Well, I have been to my earlier dentist, Dr. Himan Patel, for a few times, and he had been telling me that your teeth are, in a pretty bad condition, or they are getting to a lot of infection. So then he was recommending me to go for these all four, or remove all of them, and but then he anyway was looking for a surgeon which I could not figure out. So I could know about you via my wife's dentist, and he also recommended me, Dr. Patel, once or twice to come to you. So I came here, and it was a great experience to talk to you and to feel very, very, you made me feel very comfortable and told me a lot of things, which was a quick decision. I didn't have much time. I was running against end of year. I had to make a quick decision because I had delayed it for already 1 year. So we just decided in 2 days that yes, let's do it.
So, one of the things that we talked about is that you got to a point where your teeth were at a point where we could not save them, at least predictably, and they were at a point where could affect your health just from the infections. But one of your biggest concerns as a busy executive was to get these teeth taken care of and never really have a situation where you went without teeth.
Yes.
It was very important to you to have solid teeth, even though you were going to have these teeth removed.
Yeah, although there were options which I heard from so many, a lot of people, everybody loses teeth by some age, but they normally go for the conventional dentures.
Right.
And the main thing which was bugging me or bothering me, that I was very shredded with the idea that I will never be able to have a denture with a full palate. I had tried once a little bit and it was so uncomfortable. So that was a very dreadful thought.
Yeah.
That if I had to wear full denture on the top. So apart from the power of chewing and speech has to still go better. I'm still a little bit wobbling.
You're still adapting to that. Yeah.
Yeah, the th is still because of thickness on the denture. This is a temporary denture. But the best thing is that I don't feel anything on the palate, and it is a permanent solution. It's not that it will let loose or it will fall off. I have to take it out in the night and appear totally different than in the daytime, and clean them and put them in water. So I've seen my father do that. So that was
could be traumatic for family members to see that.
Especially at my age, I'm just 57. So
right.
It's a long way to go. So I thought it's worth doing it now. If I was 77, then you think, okay, maybe let's put a denture. Why do you invest so much money? So it was too early for me, but then it was the right decision or the right option or solution for my condition, I guess. And I took one other opinion from Dr. Patel, and Dr. John took over, and they all were the same opinion, and then you confirmed that. And with your knowledge, and you run the institute, you have seen so many cases, you teach other dentists, so I thought your word was the final.
Well, we certainly appreciate that trust. More than anything else, it's the results that we see. They're so predictable. Patients like yourself, what is rewarding is to take someone from a problematic situation to one that is going to solve their needs, their desires, meet their goals, and do that in a single procedure.
Absolutely. I think when I told my colleagues and friends that I had everything on the same day, all the teeth removed, 6 implants, and a temporary prosthesis, they're all amazed. He said, no, it's not possible, How could have all the, gaps of the removed teeth and still drill holes and get it done? Also, they're all, well, it is quite known, but not to a common man and common friends and who are younger. So they were all
amazed,
positively surprised.
Well, when we started doing these many years ago, even we as clinicians were also surprised.
If I read on internet, people were saying that go 2-stage always, because that's the most sure and validated procedure. But I think with technology and with new things coming up, and your confidence in just you doing that.
Absolutely. No question, the literature and the science supports it in very overwhelming results. But interestingly, doing it like this, we found patients have less pain.
Yes, and they are ready sooner.
Yes.
And the transition phase is shorter.
Yes.
The only thing which I was a bit concerned is that, people say that I had another bit detrimental condition was that my bone thickness was thin on the jaw, apart from the infection, and the teeth were a bit loose and with the recessed gums. So I was more concerned that because of the bone grafting, that how you have the spaces and the implants and how they will be held together and anchored properly. So that's why I think, although if you read, people say the best is that you first get all of them removed, let them heal, and then put implants. So I was last time I was a bit concerned about that. Maybe they are not symmetrical because of locations of the implants, and how they will heal up in future. Because of the one stage, did it become thicker because of the thickness you had to put to reach the gap of the removed teeth and the implant, which you couldn't be putting very close. But if you heal that bone of the removed teeth, but you said it will still be the same, that was very comforting.
Yes, it's understanding biological limitations and the physiology of healing, we're able to find predictable solutions.
Yes.
And we certainly want to give patients what will work and what will meet their goals. Obviously,
Absolutely.
as a busy executive with people and meetings all the time, we want you to have something that you're secure with. Something
and
that
it doesn't take 18 months for me to have a transition, because you
Absolutely.
told me go 2-stage.
Yeah.
You could be wearing it temporary for 18 months and,
Yeah.
and still end up with the same situation. So it was a good decision.
So you're now 6 weeks out of procedure. You're temporarily wearing this what we call a converted prosthesis, where we took a denture and teeth and we attached them to the implants at the same time.
Yes.
We're going to allow this to heal for at least another 2.5 months, and then your dentist will start making the final set of teeth,
Yes.
which will be more detailed and more designed.
Slim,
And
more sleek. And
yes, exactly.
I'm waiting for that day, but I can't expedite this process of natural healing.
Yes.
So I have to wait, and maybe I wait even another month to make sure that everything is fine.
At the end of the day, we can't hurry biology.
Sure.
But
you have a healthy baby takes 9 months. You can't.
Exactly, that's a good analogy.
Yeah,
So I'm glad you're
but
doing well.
I'm having birthday end of June. I hope I can
Congrats.
eat my cake with the new.
Absolutely, absolutely. So I'm so really glad you're doing well. What I appreciate are your questions, because you're an engineer and you asked the hard questions.
I was. You found me maybe a bit too difficult, but maybe
No,
my lack of knowledge.
No, it's good, because in this stuff is a lot of engineering and
a lot of new things which you suddenly are faced with,
Absolutely.
and you have a lot of questions for future, not today.
Absolutely.
Because it's a permanent solution, you wonder, will I stay like this all the time, or how it will come in future? So,
So we'll take another 6 weeks. We'll check back in with you, and we'll hear how things are going.
I've increased my life insurance policy because my value is more now.
That's right. Thanks again.
Yeah, thank you.
All right.